Do you think there was a problem with the Democrats? Because when President Obama was campaigning, he differentiated himself from Senator Clinton in that he said, we're not going to talk about about single payer because we know that's a non-starter. And she seemed to be more in gear for a single payer plan and fighting it out on those terms. Do you think maybe we might have given in on single payer, not given in on it too early, but by taking it off the table, gave the Republicans one less thing that they had to campaign against?
Well, I think that what the Republicans did very successfully against the original Clinton health care plan was to delay and then to use what is referred to as FUD, the FUD approach, fear, uncertainty, and doubt. This is what you do when you want to slow something down. You scare people. If you remember those commercials that they ran with a couple of characters sitting in a kitchen 15 or 16 years ago.
Yes, Harry and Louise.
That's right, Harry and Louise. And then you look at the charts and graphs they would use on the House floor and in their town hall meetings and show all these very convoluted boxes and this sort of spaghetti diagram to scare people.
Look, we're seeing again.
That's right. Fast forward, you're seeing them, their color is a little better, the graphics are a little better, the charts are a little better, but the approach is the same. And the approach is about delay. I think you've got to step back and say, who makes money on the current system and why do they want to delay this system? And if you look, you see pharmaceutical companies, you see insurance companies, you see certain groups in the medical industry, certainly not all, but you see some people who profit greatly. And there obviously are groups that are aligned against this. And the Republicans have made a decision that this is a point where they can, quite frankly, damage the president politically. And it's quite clear that they're going to do everything they can to prevent it. My personal view, because I come from a business background, because I grew up without an awful lot of things, my personal view is that the smartest thing to do is figure out where the commonality is and where you can draw Republican votes in. Because my view is without it, if you can't get those moderate Democrats and can't get some moderate Republicans, it's not going to happen. And at a minimum, I think you have to be driving a single-payer concept to say, look, we're not going that way, all right? But what we are going to do is go with a public option. And that is how we're going to cover the 46 million un-Americans who are uninsured. If the fight goes on from there, David, there's always the chance that the fallback position in Washington ends up being some kind of pooling arrangement, some kind of cooperative. But I don't think that you start there.
A lot of the battle lines right this matter of fact today in the House of Representatives seem to be drawn between the progressive coalition, the Congressional Black Caucus on one side, which I believe are about 120 members, and on the other side you have what they call the Blue Dog Democrats, which are about 50 members. How is that playing out?
Well, I think you're going to, first, and if you step back to how the Democrats retook control over the last couple of years of Congress, you recognize that many of these seats were won in essentially swing districts. And at the time that what took place was you saw Democrats, moderate Democrats, running and, quite frankly, knocking out Republicans from those seats. But the understanding was very clear that those were moderate to conservative districts. Those folks were not going to be able to have a voting record which was going to be the same as a Democrat in a safe Democratic district. And while some may deny that, those are the political realities in those congressional districts. So now you fast forward and you're in a situation where these people feel very exposed, and they feel that if they go along with what's seen as a sort of typical Democratic line on this stuff, a party line vote, that they are politically in danger themselves. And I think that, quite frankly, my sense is there's a lot more politics than policy that's driving these outcomes.
So a lot of these Blue Dog Democrats are perhaps could best be more fairly called better versions of Republicans, in a sense. A little bit more on the Democratic side on some issues, but on other issues they're going to represent that more conservative element that's in their district.
Yeah, and I don't think that's a bad thing. Look, I'm a progressive Democrat. I believe in various issues where I'm going to be more progressive than many folks. But I think that we have got to maintain a Big Tent theory. I think that's how we got into trouble the last time, is when we looked for some ideological purity test. I think that's dangerous. I don't expect all Democrats to be as progressive as I am. I don't expect them to be as progressive as I am on union issues or on international issues or economic issues or healthcare issues. But what I do expect is that even in those swing districts, that those congressional Democrats are going to remember that in fact they are Democrats, and that if at the end of the day all they care about is winning election and not forwarding progressive policy like meaningful health care reform, then at the end of the day all we have really done is change the R to a D, and we haven't changed the outcome. And I think that would be unfortunate, because again, if as I travel around the state each day, I meet so many people in this state who don't have health care coverage, who are desperately in need of coverage. Some of those folks are single moms with little kids. It's not acceptable. That's not an acceptable outcome for us. I think there's a way to do this rationally, but I think we've got to stick to our guns and keep driving the outcome.
You mentioned Harry and Louise, of course, were one of the key commercials that were run against the Clinton health care plan. Now we see Harry and Louise re-emerging this time around on the other, supposedly on the other side of the issue. But if you look at the disclaimer on the bottom of the commercials, their ads are being financed by pharma, the pharmaceutical companies. You remember back to 2005 where the Republicans jammed through Medicare Part D. I think I have that correct. And in the process guaranteed billions, I think in fact it was almost $1 trillion in excess profits to pharmaceutical companies and HMOs in order to amp up, in order to improve health care for seniors. Of course, that left a donut hole, which we're talking about again now, because that didn't seem to get much coverage back then. Is it possible that we'll end up with a similar situation this time, where the pharmaceutical companies and the HMOs will end up still entrenched in power, but at the same time, all Americans will be forced with government money to go to those HMOs for their coverage? Is that a possibility?
Well, I think that there are a lot of possibilities which are less than favorable that are out there. I think that the challenge really is to always look and say, who is financing the campaigns of these people in Congress? I think you've got to look. When you see, for example, a sitting senator who's on these committees, and you see all these mailings happening, and you get the mailings at your house, and you look and it says paid for by the pharmaceutical company, paid for by the insurance industry, that should cause you concern. My question is always, why are those people working so hard to keep some of these career politicians in power?
Now, I ran for state representative last year, and I saw what seemed like a very rapid transformation in the positive sense with public financing in Connecticut. And our hope, I'm sure your hope also, as you've talked about it quite a bit, that we end up with a public financing package nationally. So like state politicians in Connecticut have started to get used to not being beholden to special interests, to drug companies and banks and whatnot. Hopefully, ultimately, we'll get to the point where, on a national level, senators and representatives will be in that same situation of being more beholden to voters. Than we're going to come back from public service announcement in another minute, and we'll talk more about that and other votes.
Okay.
This is Progressive Sue.